Question 1. A client with hypertension has been prescribed hydrochlorothiazide. Which potential side effect should the nurse monitor for? A. Hyperglycemia. B. Hypokalemia. C. Hyponatremia. D. Hypercalcemia. Answer B. Hypokalemia. Rationale: hydrochlorothiazide is a thiazide diuretic that can lead to potassium excretion, potentially causing hypokalemia. Question 2. The nurse is caring for a client who has just had a pacemaker insertion. Which nursing intervention is most appropriate? A. Encouraging the client to raise the arm on the side of the insertion site. B. Checking the insertion site for swelling, redness, and discharge. C. Advising the client to avoid using electrical appliances. D. Administering aspirin for pain relief. Answer B. Checking the insertion site for swelling, redness, and discharge. Rationale: monitoring the insertion site for signs of infection or complications is crucial after pacemaker insertion. Question 3. Which statement made by a client with congestive heart failure indicates they understand their dietary restrictions? A. I will increase my protein intake. B. I'll avoid adding salt to my meals. C. I can eat bananas every day. D. I'll drink at least 3 liters of water daily. Answer B. I'll avoid adding salt to my meals. Rationale: clients with CHF are typically advised to follow a low-sodium diet to prevent fluid retention. Question 4. The nurse recognizes that which lab value is most consistent with a diagnosis of myocardial infarction? A. Elevated white blood cell count. B. Decreased platelet count. C. Elevated troponin level. D. Decreased potassium level. Answer C. Elevated troponin level. Rationale: troponin is a specific marker for myocardial injury. Its level rises within a few hours of a heart attack. Question 5. A client is prescribed warfarin therapy. Which food should the nurse advise the client to consume in moderation due to its effect on anticoagulation? A. Spinach. B. Oranges. C. Apples. D. Carrots. Answer A. Spinach. Rationale: spinach is high in vitamin K, which can counteract the effects of warfarin, a vitamin K antagonist. Question 6. A nurse is caring for a client with aortic stenosis. Which symptom is most indicative of this condition? A. Chest pain. B. Cyanosis. C. Palpitations. D. Wheezing. Answer A. Chest pain. Rationale: aortic stenosis can cause reduced blood flow from the left ventricle, leading to chest pain or angina. Question 7. The nurse is instructing a client on how to take their nitroglycerin tablets. Which statement indicates client understanding? A. I'll swallow the tablet with a glass of water. B. I will place the tablet under my tongue and let it dissolve. C. I need to chew the tablet for faster relief. D. I can take up to 10 tablets a day. Answer B. I will place the tablet under my tongue and let it dissolve. Rationale: nitroglycerin is taken sublingually, under the tongue, for rapid absorption and quick relief of angina. Question 8. A client is diagnosed with peripheral arterial disease. Which assessment finding is most consistent with this diagnosis? A. Warm, flushed skin on the affected extremity. B. Pitting edema in the affected limb. C. Strong pedal pulses. D. Intermittent claudication. Answer D. Intermittent claudication. Rationale: intermittent claudication, or pain with walking that's relieved with rest, is a classic symptom of peripheral arterial disease due to reduced blood flow to the affected extremity. Question 9. A nurse is preparing a client for a cardiac catheterization. Which statement by the client warrants further investigation? A. I had a light breakfast this morning. B. I am anxious about the procedure. C. I have had this procedure done before. D. I hope this will help my doctor identify the problem. Answer A. I had a light breakfast this morning. Rationale. Clients are typically advised to fast for several hours before a cardiac catheterization. Question 10. A client with a history of deep vein thrombosis, DVT, is to be discharged on enoxaparin. The nurse should instruct the client to monitor for which side effect? A. Dry mouth. B. Constipation. C. Hematuria. D. Insomnia. Answer C. Hematuria. Rationale. Enoxaparin is an anticoagulant. Hematuria, blood in the urine, can indicate excessive anticoagulation or bleeding complications. Question 11. The nurse is assessing a client's risk for coronary artery disease, CAD. Which risk factor is modifiable? A. Family history of CAD. B. Age over 65. C. Smoking. D. Gender. Answer C. Smoking. Rationale. Smoking is a modifiable risk factor for CAD. Interventions can be initiated to help the client quit smoking, thus reducing their risk. Question 12. Which medication is typically prescribed to reduce the risk of stroke in clients with atrial fibrillation? A. Furosemide. B. Digoxin. C. Amiodarone. D. Warfarin. Answer D. Warfarin. Rationale. Atrial fibrillation can lead to clot formation in the atria, increasing the risk of stroke. Warfarin, an anticoagulant, is often prescribed to reduce this risk. Question 13. A client presents to the emergency department with a suspected myocardial infarction, MI. Which medication would the nurse anticipate administering first? A. Morphine. B. Furosemide. C. Aspirin. D. Potassium chloride. Answer C. Aspirin. Rationale. Aspirin is an antiplatelet agent that can prevent further clot formation, making it crucial in the early management of an MI. Question 14. During an assessment, a nurse observes that a client's jugular veins are distended when sitting at a 45-degree angle. This finding is consistent with A. Right-sided heart failure. B. Left-sided heart failure. C. Dehydration. D. Hypovolemia. Answer A. Right-sided heart failure. Rationale. Jugular venous distension, JVD, is a sign of increased central venous pressure, often seen in right-sided heart failure. Question 15. A client with heart failure reports increasing shortness of breath. The nurse would expect to hear which lung sound upon auscultation? A. Rhonchi. B. Wheezing. C. Crackles. D. Stridor. Answer C. Crackles. Rationale. Crackles or rowels are heard when fluid accumulates in the alveoli, consistent with pulmonary edema often seen in heart failure. Question 16. A client is taking digoxin for atrial fibrillation. The nurse knows to monitor for which sign of digoxin toxicity? A. tachycardia. B. Hypertension. C. Yellow-tinged vision. D. Tremors. Answer, C. Yellow-tinged vision. Rationale. Yellow-tinged vision, xanthopsia, is a classic sign of digoxin toxicity. Question 17. A nurse observes an inverted T wave on a client's ECG. This finding is most consistent with A. Myocardial infarction. B. Hypokalemia. C. Myocardial ischemia. D. Atrial fibrillation. Answer, C. Myocardial ischemia. Rationale. Inverted T waves on an ECG are indicative of myocardial ischemia. Question 18. Which nursing intervention is most appropriate for a client with venous insufficiency? A. Elevating the legs above heart level. B. Applying heat to the affected limbs. C. Encouraging crossing of the legs. D. Restricting fluid intake. Answer, A. Elevating the legs above heart level. Rationale. Elevating the legs helps to reduce swelling and improve venous return in clients with venous insufficiency. Question 19. A client reports chest pain radiating to the left arm with nausea and sweating. The nurse should first A. Obtain an ECG. B. Administer nitroglycerin. C. Begin CPR. D. Administer morphine. Answer, A. Obtain an ECG. Rationale. The client's symptoms are consistent with a myocardial infarction. An ECG is essential to confirm the diagnosis and determine the severity and location of the MI. Question 20. Which diagnostic test can best determine the ejection fraction of a client's heart? A. ECG. B. Chest X-ray. C. Echocardiogram. D. Cardiac catheterization. Answer, C. Echocardiogram. Rationale. An echocardiogram provides a visual representation of the heart's chambers and can accurately measure the ejection fraction. Question 21. A nurse is monitoring a client for postural hypotension. The correct way to do this is A. Measure blood pressure after the client has been lying down, then immediately after standing. B. Measure blood pressure while the client is walking. C. Measure blood pressure after the client has been sitting, then after exercising. D. Measure blood pressure immediately upon waking up. Answer, A. Measure blood pressure after the client has been lying down, then immediately after standing. Rationale. Postural or orthostatic hypotension is a drop in blood pressure when moving from a lying to a standing position. Question 22. Which assessment finding indicates a therapeutic response to a beta blocker? A. Pulse rate below 50 beats per minute. B. Reduced chest pain. C. Blood pressure of 90/60 mm of mercury. D. Presence of pedal edema. Answer, B. Reduced chest pain. Rationale. Beta blockers reduce heart rate and blood pressure, reducing myocardial oxygen demand. This can help alleviate chest pain, angina, in clients with CAD. Question 23. A client with chronic heart failure starts to exhibit signs of digoxin toxicity. The nurse anticipates administering which medication as an antidote? A. Naloxone. B. Flumazenol. C. Vitamin K. D. Digobind. Answer, D. Digobind. Rationale. Digibind or digoxin immune fab is the antidote for digoxin toxicity. Question 24. A client is prescribed an ACE inhibitor. The nurse should instruct the client to report which side effect immediately. A. Dry cough. B. Diarrhea. C. Insomnia. D. Tinnitus. Answer A. Dry cough. Rationale. A persistent dry cough is a known side effect of ACE inhibitors and may indicate that the client needs a change in medication. Question 25. A nurse is teaching a client about the warning signs of a stroke. Which symptoms should be included in the teaching? A. Tremors. B. Sudden confusion. C. Persistent headache. D. Abdominal pain. Answer B. Sudden confusion. Rationale. Sudden confusion, trouble speaking, or difficulty understanding are warning signs of a stroke. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.
Hi everyone, this is Nurse Anna from nursestudy.net, and in this series we're going to be doing cardiovascular disorders, nursing questions with rationales, and this is 75 questions. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A 62-year-old male patient presents to the emergency department with severe chest pain radiating to his left arm and jaw, accompanied by shortness of breath and diaphoresis. Which of the following is the priority action? A. Administer nitroglycerin sublingually. B. Obtain an ECG. C. Administer oxygen via nasal cannula. D. Initiate an IV line. Answer B. Obtain an ECG. Rationale. Obtaining an ECG is the priority to quickly diagnose a potential myocardial infarction, MI. Administering nitroglycerin or oxygen and initiating an IV line are also important but follow the confirmation of an MI with an ECG. Question 2. A patient with a history of congestive heart failure, CHF, is admitted with worsening dyspnea, orthopnea, and lower extremity edema. Which laboratory test result is most indicative of exacerbation of CHF? A. Elevated troponin levels. B. Elevated B-type natriuretic peptide, BNP, levels. C. Elevated creatine kinase, CKMB, levels. D. Elevated C-reactive protein, CRP, levels. Answer B. Elevated B-type natriuretic peptide, BNP, levels. Rationale. BNP is a marker specific for heart failure. Elevated levels indicate the heart's increased workload and the severity of heart failure. Question 3. A patient with atrial fibrillation is started on warfarin therapy. Which of the following instructions is crucial for the nurse to provide to this patient? A. Avoid foods high in vitamin K. B. Avoid all types of exercise. C. Increase your intake of green leafy vegetables. D. Take warfarin on an empty stomach. Answer A. Avoid foods high in vitamin K. Rationale. Vitamin K can decrease the effectiveness of warfarin. Patients should maintain a consistent intake of vitamin K and avoid sudden changes in their diet. Question 4. A 45-year-old female with a history of hypertension is admitted with a sudden onset of severe headache, visual disturbances, and confusion. Blood pressure is 240 over 130 millimeters of mercury. Which of the following medications would the nurse anticipate the healthcare provider to order? A. Lisinopril. B. Nifedipine. C. Sodium nitroprusside. D. Hydrochlorothiazide. Answer C. Sodium nitroprusside. Rationale. Sodium nitroprusside is a potent vasodilator used in hypertensive emergencies to rapidly lower blood pressure. Lisinopril and hydrochlorothiazide are for chronic management, and nifedipine is less effective in acute settings. Question 5. A patient with mitral valve stenosis is at risk for developing atrial fibrillation. What is the primary reason for this increased risk? A. Decreased cardiac output. B. Left atrial enlargement. C. Ventricular hypertrophy. D. Increased pulmonary pressure. Answer. B. Left atrial enlargement. Rationale. Mitral valve stenosis leads to increased pressure in the left atrium, causing it to enlarge. This enlargement predisposes the patient to atrial fibrillation. Question 6. A patient is admitted with an acute myocardial infarction and is receiving thrombolytic therapy. Which of the following signs would indicate a possible complication of this treatment? A. A decrease in chest pain. B. The appearance of a new onset of a loud systolic murmur. C. A rise in blood pressure. D. Bradycardia. Answer. B. The appearance of a new onset of a loud systolic murmur. Rationale. A new murmur can indicate a complication such as a ventricular septal defect or mitral valve rupture, both of which are serious complications of an MI and thrombolytic therapy. Question 7. A patient with heart failure is on digoxin therapy. The nurse notes the patient is experiencing nausea, vomiting, and visual disturbances. What is the nurse's best action? A. Administer the next dose of digoxin. B. Check the patient's serum potassium levels. C. Check the patient's digoxin levels. D. Encourage the patient to drink more fluids. Answer. C. Check the patient's digoxin levels. Rationale. Nausea, vomiting, and visual disturbances are signs of digoxin toxicity. The digoxin level should be checked to confirm toxicity. Question 8. A patient presents with symptoms of heart failure, including dyspnea on exertion and fatigue. The healthcare provider orders an echocardiogram. What information does this test provide that is crucial for diagnosing heart failure? A. Blood flow through coronary arteries. B. Presence of myocardial infarction. C. Left ventricular ejection fraction. D. Electrical activity of the heart. Answer. C. Left ventricular ejection fraction. Rationale. An echocardiogram measures the left ventricular ejection fraction, LVEF, which indicates how well the heart is pumping blood. A reduced LVEF is a key indicator of heart failure. Question 9. A patient with a history of coronary artery disease presents with crushing chest pain, sweating, and nausea. The nurse immediately administers oxygen and obtains a 12-lead ECG. Which ECG finding is most indicative of a myocardial infarction? A. Sinus bradycardia. B. ST segment elevation. C. Inverted T waves. D. Prolonged PR interval. Answer. B. ST segment elevation. Rationale. ST segment elevation on an ECG is a classic indicator of an acute myocardial infarction, representing injury to the heart muscle. Question 10. A patient with a suspected pulmonary embolism, PE, is experiencing sudden shortness of breath, chest pain, and a rapid heart rate. What diagnostic test does the nurse anticipate will be ordered first? A. Chest X-ray. B. D-dimer test. C. Pulmonary angiography. D. Spiral CT scan. Answer. D. Spiral CT scan. Rationale. A spiral CT scan, also known as CT pulmonary angiography, is the gold standard for diagnosing a pulmonary embolism. It provides detailed images of blood vessels in the lungs. Question 11. A patient in the ICU develops ventricular fibrillation. What is the first action the nurse should take? A. Administer amiodarone IV. B. Prepare for synchronized cardioversion. C. Start chest compressions. D. Defibrillate immediately. Answer: D. Defibrillate immediately. Rationale: ventricular fibrillation is a life-threatening arrhythmia that requires immediate defibrillation to restore a viable heart rhythm. Question 12. A patient with aortic stenosis is experiencing syncope and angina. What pathophysiological mechanism underlies these symptoms? A. Increased cardiac output. B. Decreased afterload. C. Decreased coronary perfusion. D. Decreased preload. Answer: C. Decreased coronary perfusion. Rationale: aortic stenosis leads to increased resistance to blood flow from the left ventricle, resulting in decreased coronary perfusion and subsequently causing syncope and angina. Question 13. A patient is being treated for hypertensive crisis. Which medication should the nurse expect to administer for rapid blood pressure reduction? A. Metoprolol. B. Lisinopril. C. Hydralazine. D. Clonidine. Answer: C. Hydralazine. Rationale: hydralazine is a fast-acting vasodilator used to quickly lower blood pressure in hypertensive emergencies. Question 14. A patient with a pacemaker is experiencing dizziness and fatigue. The ECG shows bradycardia with a rate of 40 beats per minute. What is the most likely explanation for these symptoms? A. Myocardial infarction. B. Pacemaker failure. C. Electrolyte imbalance. D. Sinus arrhythmia. Answer: B. Pacemaker failure. Rationale: symptoms of bradycardia and an ECG showing a slow heart rate in a patient with a pacemaker suggest pacemaker malfunction or failure. Question 15. A patient with a history of myocardial infarction is experiencing new onset of dyspnea and orthopnea. What is the most likely cause of these symptoms? A. Pulmonary embolism. B. Left ventricular failure. C. Right ventricular failure. D. Pneumonia. Answer: B. Left ventricular failure. Rationale: left ventricular failure causes a backup of blood into the pulmonary circulation, leading to pulmonary congestion and symptoms of dyspnea and orthopnea. Question 16. A patient with dilated cardiomyopathy is admitted with severe dyspnea and fatigue. The echocardiogram shows a severely reduced ejection fraction. What is the primary nursing goal for this patient? A. Increase physical activity. B. Improve cardiac output. C. Reduce fluid intake. D. Maintain normal blood pressure. Answer: B. Improve cardiac output. Rationale: the primary goal is to improve cardiac output to alleviate symptoms and enhance the patient's quality of life. This may involve medications, lifestyle changes, and possible surgical interventions. Question 17. A patient with unstable angina is scheduled for a cardiac catheterization. What pre-procedure assessment is most critical? A. Renal function tests. B. Blood glucose levels. C. Serum electrolyte levels. D. Complete blood count, CBC. Answer: A. Renal function tests. Rationale. Renal function tests are crucial because the contrast dye used in cardiac catheterization can be nephrotoxic, and pre-existing renal impairment increases the risk of contrast-induced nephropathy. Question 18. A patient with a history of chronic atrial fibrillation is admitted with signs of heart failure. Which medication is most likely to be included in their treatment plan to control heart rate? A. Digoxin. B. Furosemide. C. Lisinopril. D. Spironolactone. Answer: A. Digoxin. Rationale. Digoxin is used to control heart rate in patients with chronic atrial fibrillation and to improve symptoms of heart failure. Question 19. A patient presents with acute shortness of breath, a high-pitched inspiratory stridor, and hypotension. What is the nurse's priority action? A. Administer epinephrine. B. Start an IV line. C. Apply a non-rebreather mask. D. Perform a needle decompression. Answer: A. Administer epinephrine. Rationale. The symptoms suggest anaphylaxis, which requires immediate administration of epinephrine to prevent airway obstruction and circulatory collapse. Question 20. A patient with a recent diagnosis of deep vein thrombosis, DVT, is started on anticoagulant therapy. Which instruction should the nurse include in the patient teaching? A. Wear compression stockings only at night. B. Avoid green leafy vegetables. C. Report any unusual bleeding or bruising. D. Increase vitamin K intake. Answer: C. Report any unusual bleeding or bruising. Rationale. Patients on anticoagulant therapy should be vigilant about signs of bleeding and bruising, as these can indicate complications from the medication. Question 21. A 60-year-old male with diabetes and hypertension presents with palpitations, dizziness, and a heart rate of 150 beats per minute. The ECG shows supraventricular tachycardia, SVT. What is the first-line treatment? A. Vagal maneuvers. B. Amiodarone IV. C. Synchronized cardioversion. D. Verapamil IV. Answer: A. Vagal maneuvers. Rationale. Vagal maneuvers are the first-line treatment for SVT as they can often terminate the arrhythmia non-pharmacologically. Question 22. A patient with hypertrophic cardiomyopathy is experiencing chest pain and dyspnea on exertion. Which medication should be avoided in this patient? A. Beta blockers. B. Calcium channel blockers. C. Diuretics. D. Nitrates. Answer: D. Nitrates. Rationale. Nitrates should be avoided in hypertrophic cardiomyopathy because they can reduce preload, worsening the obstruction and symptoms. Question 23. A patient with left-sided heart failure is prescribed furosemide. Which electrolyte imbalance is the nurse most concerned about monitoring for? A. Hyperkalemia. B. Hypernatremia. C. Hypokalemia. D. Hypercalcemia. Answer: C. Hypokalemia. Rationale. Furosemide is a loop diuretic that can cause significant potassium loss, leading to hypokalemia. Question 24. A patient is admitted with a suspected myocardial infarction. The nurse notes a new onset of a loud, holosystolic murmur at the apex. What complication should the nurse suspect? A. Mitral regurgitation. B. Aortic stenosis. C. Tricuspid regurgitation. D. Ventricular septal defect. Answer: A. Mitral regurgitation. Rationale: a new holosystolic murmur at the apex in the setting of an MI suggests acute mitral regurgitation, possibly due to papillary muscle dysfunction or rupture. Question 25. A patient with a history of aortic aneurysm is admitted with sudden, severe chest pain radiating to the back. Blood pressure is significantly higher in the right arm compared to the left. What condition should the nurse suspect? A. Myocardial infarction. B. Aortic dissection. C. Pulmonary embolism. D. Pericarditis. Answer: B. Aortic dissection. Rationale: severe chest pain radiating to the back and a significant blood pressure difference between arms are classic signs of an aortic dissection, which is a medical emergency. Question 26. A patient with heart failure is experiencing increased shortness of breath and weight gain. The nurse assesses pitting edema in the lower extremities. Which diagnostic test will provide the most useful information about the patient's condition? A. Chest X-ray. B. Echocardiogram. C. Serum BNP level. D. Electrocardiogram ECG. Answer: C. Serum BNP level. Rationale: BNP levels are directly related to the severity of heart failure and will provide useful information about the patient's current status and the need for adjustments in treatment. Question 27. A patient with coronary artery disease is prescribed atorvastatin. Which lab test is most important to monitor for adverse effects? A. Complete blood count, CBC. B. Liver function tests, LFTs. C. Serum electrolytes. D. Renal function tests. Answer: B. Liver function tests, LFTs. Rationale: atorvastatin can cause hepatotoxicity, so liver function tests are important to monitor for adverse effects. Question 28. A patient with atrial fibrillation is being prepared for elective cardioversion. What is the most critical pre-procedure step to prevent complications? A. Administering a beta blocker. B. Ensuring the patient is NPO for 6 hours. C. Confirming the patient has been anticoagulated. D. Obtaining a complete blood count, CBC. Answer: C. Confirming the patient has been anticoagulated. Rationale: anticoagulation is crucial to prevent thromboembolic events during and after cardioversion, as atrial fibrillation increases the risk of clot formation. Question 29. A patient with acute pericarditis presents with sharp chest pain that worsens with inspiration and is relieved by sitting forward. What finding on the ECG would support this diagnosis? A. ST segment elevation in all leads. B. ST segment depression in leads 2, 3, and AVF. C. Tall, peaked T waves. D. Q waves in leads V1 to V4. Answer: A. ST segment elevation in all leads. Rationale: diffuse ST segment elevation across multiple leads is characteristic of acute pericarditis. Question 30. A patient with congestive heart failure is on spironolactone therapy. What electrolyte imbalance is a potential side effect of this medication? A. Hypokalemia. B. Hyperkalemia. C. Hypernatremia. D. Hypocalcemia. Answer: B. Hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic, which can lead to hyperkalemia. Question 31. A patient with mitral valve prolapse is experiencing palpitations and dizziness. Which lifestyle modification should the nurse recommend to reduce these symptoms? A. Increase caffeine intake. B. Avoid strenuous exercise. C. Increase fluid and salt intake. D. Avoid beta blockers. Answer: C. Increase fluid and salt intake. Rationale: increasing fluid and salt intake can help maintain blood volume and reduce the incidence of palpitations and dizziness associated with mitral valve prolapse. Question 32. A patient with infective endocarditis presents with a new murmur and fever. What is the most critical initial diagnostic test? A. Blood cultures. B. Echocardiogram. C. Complete blood count, CBC. D. Chest X-ray. Answer: A. Blood cultures. Rationale: blood cultures are essential for identifying the causative organism in infective endocarditis, guiding appropriate antibiotic therapy. Question 33. A patient with pulmonary edema is receiving continuous positive airway pressure, CPAP, therapy. What is the primary benefit of this treatment? A. Reduces fluid overload. B. Decreases cardiac workload. C. Improves oxygenation. D. Reduces blood pressure. Answer: C. Improves oxygenation. Rationale: CPAP therapy helps keep the airways open, improving oxygenation and reducing the work of breathing in patients with pulmonary edema. Question 34. A patient with a recent heart transplant is being monitored for signs of rejection. What is a primary indicator of acute rejection? A. Hypertension. B. Fever and malaise. C. Bradycardia. D. Increased urine output. Answer: B. Fever and malaise. Rationale: fever and malaise are common signs of acute rejection in heart transplant patients, indicating an immune response against the transplanted organ. Question 35. A patient with acute decompensated heart failure is prescribed dobutamine. What is the primary action of this medication? A. Decreases preload. B. Increases myocardial contractility. C. Reduces afterload. D. Increases heart rate. Answer: B. Increases myocardial contractility. Rationale: dobutamine is a positive inotropic agent that increases myocardial contractility, improving cardiac output in patients with heart failure. Question 36. A patient is admitted with a diagnosis of acute coronary syndrome. Which lab result is most specific for myocardial injury? A. Elevated CKMB. B. Elevated troponin. C. Elevated myoglobin. D. Elevated lactate dehydrogenase, LDH. Answer: B. Elevated troponin. Rationale: troponin is the most specific biomarker for myocardial injury and is used to diagnose acute coronary syndrome. Question 37. A patient with a history of hypertension is experiencing a hypertensive emergency with a blood pressure of 220 over 120 millimeters of mercury. What medication would the nurse anticipate administering for rapid blood pressure control? A. Lisinopril. B. Nitroprusside. C. Amlodipine. D. Hydrochlorothiazide. Answer: B. Nitroprusside. Rationale: nitroprusside is a potent vasodilator used in hypertensive emergencies to quickly lower blood pressure. Question 38. A patient with chronic heart failure is prescribed an ACE inhibitor. Which side effect should the nurse monitor for? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypocalcemia. Answer: A. Hyperkalemia. Rationale: ACE inhibitors can cause hyperkalemia by reducing aldosterone secretion, leading to potassium retention. Question 39. A patient with angina pectoris is prescribed nitroglycerin. Which instruction is important for the nurse to provide? A. Take the medication with meals. B. Store the medication in a dark, glass bottle. C. Swallow the tablet whole. D. Take the medication before physical activity. Answer: B. Store the medication in a dark, glass bottle. Rationale: nitroglycerin should be stored in a dark, glass bottle to protect it from light and moisture, which can degrade the medication. Question 40. A patient with a history of myocardial infarction is experiencing recurrent episodes of chest pain. What ECG finding would indicate ischemia? A. ST segment elevation. B. ST segment depression. C. Tall, peaked T waves. D. Q waves in leads 2, 3, and AVF. Answer: B. ST segment depression. Rationale: ST segment depression is indicative of myocardial ischemia, suggesting reduced blood flow to the heart muscle. Question 41. A patient with hypertrophic cardiomyopathy is at risk for sudden cardiac death. What intervention is most appropriate for this patient? A. Beta blockers. B. Implantable cardioverter defibrillator (ICD). C. Diuretics. D. Calcium channel blockers. Answer: B. Implantable cardioverter defibrillator (ICD). Rationale: an ICD is the most effective intervention for preventing sudden cardiac death in patients with hypertrophic cardiomyopathy. Question 42. A patient with acute coronary syndrome is receiving heparin therapy. What is the most critical lab value to monitor? A. Platelet count. B. Prothrombin time, PT. C. Activated partial thromboplastin time, APTT. D. Hemoglobin level. Answer: C. Activated partial thromboplastin time, APTT. Rationale: APTT is used to monitor the therapeutic effect of heparin and adjust the dosage to maintain the desired anticoagulation level. Question 43. A patient with suspected acute myocardial infarction is experiencing severe chest pain unrelieved by nitroglycerin. What is the nurse's priority action? A. Administer morphine. B. Obtain an ECG. C. Administer aspirin. D. Start an IV line. Answer: B. Obtain an ECG. Rationale: obtaining an ECG is the priority to confirm the diagnosis of myocardial infarction and guide further treatment. Question 44. A patient with left ventricular failure is experiencing severe dyspnea and frothy, pink-tinged sputum. What is the most likely cause of these symptoms? A. Acute coronary syndrome. B. Pulmonary edema. C. Pleural effusion. D. Chronic obstructive pulmonary disease, COPD. Answer: B. Pulmonary edema. Rationale: severe dyspnea and frothy, pink-tinged sputum are classic signs of pulmonary edema, often resulting from left ventricular failure. Question 45. A patient with atrial fibrillation is prescribed warfarin. What is the therapeutic goal for the patient's INR? A. 1.0 to 2.0. B. 2.0 to 3.0. C. 3.0 to 4.0. D. 4.0 to 5.0. Answer: B. 2.0 to 3.0. Rationale: the therapeutic goal for INR in patients on warfarin for atrial fibrillation is typically between 2.0 and 3.0 to prevent thromboembolic events. Question 46. A patient with chronic heart failure is experiencing fatigue and decreased exercise tolerance. What is the most appropriate intervention to improve these symptoms? A. Increase fluid intake. B. Encourage bed rest. C. Initiate a regular exercise program. D. Administer diuretics. Answer: C. Initiate a regular exercise program. Rationale: a regular exercise program can improve exercise tolerance and reduce fatigue in patients with chronic heart failure. Question 47. A patient with a history of rheumatic heart disease presents with signs of heart failure. What is the most likely cause of these symptoms? A. Mitral valve stenosis. B. Aortic valve regurgitation. C. Tricuspid valve stenosis. D. Pulmonary valve stenosis. Answer: A. Mitral valve stenosis. Rationale: rheumatic heart disease often leads to mitral valve stenosis, which can cause heart failure due to obstruction of blood flow from the left atrium to the left ventricle. Question 48. A patient with acute coronary syndrome is scheduled for percutaneous coronary intervention, PCI. What is the primary goal of this procedure? A. Reduce blood pressure. B. Restore blood flow to the myocardium. C. Decrease heart rate. D. Prevent arrhythmias. Answer: B. Restore blood flow to the myocardium. Rationale: the primary goal of PCI is to restore blood flow to the myocardium by opening blocked coronary arteries. Question 49. A patient with endocarditis is receiving intravenous antibiotics. Which finding would indicate a complication of this condition? A. New onset of a heart murmur. B. Decreased urine output. C. Elevated white blood cell count. D. Positive blood cultures. Answer: A. New onset of a heart murmur. Rationale: a new heart murmur can indicate valve damage or dysfunction, a common complication of endocarditis. Question 50. A patient with cardiogenic shock is receiving dobutamine. What is the primary action of this medication? A. Decreases preload. B. Increases myocardial contractility. C. Reduces afterload. D. Increases heart rate. Answer: B. Increases myocardial contractility. Rationale: dobutamine is a positive inotropic agent that increases myocardial contractility, improving cardiac output in patients with cardiogenic shock. Question 51. A patient with aortic regurgitation presents with dyspnea and fatigue. What is the primary pathophysiological mechanism causing these symptoms? A. Increased afterload. B. Increased preload. C. Decreased cardiac output. D. Decreased systemic vascular resistance. Answer: B. Increased preload. Rationale: aortic regurgitation leads to increased preload due to the backflow of blood from the aorta into the left ventricle, causing dyspnea and fatigue. Question 52. A patient with hypertensive heart disease presents with signs of heart failure. What is the most likely underlying mechanism? A. Left ventricular hypertrophy. B. Right ventricular hypertrophy. C. Pulmonary hypertension. D. Aortic stenosis. Answer: A. Left ventricular hypertrophy. Rationale: hypertensive heart disease often leads to left ventricular hypertrophy, which can progress to heart failure due to increased workload on the heart. Question 53. A patient with acute coronary syndrome is receiving a continuous heparin infusion. What lab value should be monitored to ensure therapeutic anticoagulation? A. INR. B. APTT. C. Platelet count. D. Hemoglobin. Answer: B. APTT. Rationale: APTT is used to monitor the effectiveness of heparin therapy and to adjust the dosage to maintain therapeutic anticoagulation levels. Question 54. A patient with a history of chronic kidney disease presents with severe hyperkalemia. What is the nurse's priority intervention? A. Administer sodium polystyrene sulfonate, Kexalate. B. Administer calcium gluconate IV. C. Initiate hemodialysis. D. Administer insulin and glucose. Answer: B. Administer calcium gluconate IV. Rationale: severe hyperkalemia can lead to life-threatening cardiac dysrhythmias. Administering calcium gluconate IV stabilizes the cardiac membrane and reduces the risk of arrhythmias. While other interventions like sodium polystyrene sulfonate, insulin and glucose, and hemodialysis are also used to lower potassium levels, calcium gluconate provides immediate protection to the heart, making it the priority intervention. Question 55. A patient with chronic stable angina is prescribed a beta blocker. What is the primary reason for this medication? A. Increase heart rate. B. Reduce myocardial oxygen demand. C. Increase cardiac output. D. Dilate coronary arteries. Answer: B. Reduce myocardial oxygen demand. Rationale: beta blockers reduce myocardial oxygen demand by decreasing heart rate and contractility, helping to relieve angina symptoms. Question 56. A patient with acute decompensated heart failure is receiving furosemide IV. What is the primary goal of this treatment? A. Increase heart rate. B. Reduce fluid overload. C. Decrease blood pressure. D. Increase cardiac output. Answer: B. Reduce fluid overload. Rationale: furosemide is a diuretic used to reduce fluid overload in patients with acute decompensated heart failure, improving symptoms and reducing the workload on the heart. Question 57. A patient with a history of myocardial infarction is prescribed clopidogrel. What is the primary action of this medication? A. Reduce heart rate. B. Prevent platelet aggregation. C. Lower blood pressure. D. Increase cardiac output. Answer: B. Prevent platelet aggregation. Rationale: clopidogrel is an antiplatelet agent that prevents platelet aggregation, reducing the risk of thrombotic events in patients with a history of myocardial infarction. Question 58. A patient with dilated cardiomyopathy presents with signs of heart failure. What is the primary underlying cause of this condition? A. Myocardial ischemia. B. Viral infection. C. Hypertension. D. Idiopathic. Answer: D. Idiopathic. Rationale: dilated cardiomyopathy often has an idiopathic cause, although it can also result from myocardial ischemia, viral infections, and hypertension. Question 59. A patient with chronic atrial fibrillation is prescribed an anticoagulant. What is the primary reason for this medication? A. Reduce heart rate. B. Prevent stroke. C. Increase cardiac output. D. Decrease blood pressure. Answer: B. Prevent stroke. Rationale: anticoagulants are prescribed to prevent stroke in patients with chronic atrial fibrillation, as the arrhythmia increases the risk of thromboembolic events. Question 60. A patient with acute pericarditis is experiencing severe chest pain. What is the most appropriate initial intervention? A. Administer ibuprofen. B. Apply a heating pad. C. Encourage deep breathing exercises. D. Administer nitroglycerin. Answer: A. Administer ibuprofen. Rationale: nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, are the first-line treatment for pain relief in acute pericarditis. Question 61. A patient with a recent myocardial infarction is experiencing hypotension and decreased urine output. What is the most likely cause of these symptoms? A. Cardiogenic shock. B. Pulmonary embolism. C. Acute renal failure. D. Dehydration. Answer: A. Cardiogenic shock. Rationale: hypotension and decreased urine output after a myocardial infarction suggest cardiogenic shock, where the heart cannot pump enough blood to meet the body's needs. Question 62. A patient with chronic heart failure is experiencing increased shortness of breath and fatigue. What is the most appropriate dietary modification for this patient? A. Low protein diet. B. High carbohydrate diet. C. Low sodium diet. D. High fat diet. Answer: C. Low sodium diet. Rationale: a low sodium diet helps reduce fluid retention and alleviate symptoms in patients with chronic heart failure. Question 63. A patient with stable angina is prescribed a long-acting nitrate. What is the primary benefit of this medication? A. Increase heart rate. B. Reduce myocardial oxygen demand. C. Increase cardiac output. D. Prevent coronary artery spasm. Answer: B. Reduce myocardial oxygen demand. Rationale: long-acting nitrates reduce myocardial oxygen demand by dilating veins, which decreases preload and the workload on the heart. Question 64. A patient with acute coronary syndrome is receiving dual antiplatelet therapy, DAPT. What is the primary goal of this treatment? A. Reduce heart rate. B. Prevent platelet aggregation. C. Lower blood pressure. D. Increase cardiac output. Answer: B. Prevent platelet aggregation. Rationale: DAPT, which typically includes aspirin and another antiplatelet agent, aims to prevent platelet aggregation and reduce the risk of thrombotic events in acute coronary syndrome. Question 65. A patient with heart failure is experiencing increased fatigue and dyspnea. What is the most appropriate intervention to improve symptoms? A. Increase fluid intake. B. Encourage bed rest. C. Initiate a low-sodium diet. D. Administer beta blockers. Answer: C. Initiate a low-sodium diet. Rationale: a low-sodium diet helps reduce fluid retention and alleviate symptoms in patients with heart failure. Question 66. A patient with acute myocardial infarction is prescribed a beta blocker. What is the primary reason for this medication? A. Increase heart rate. B. Reduce myocardial oxygen demand. C. Increase cardiac output. D. Dilate coronary arteries. Answer B. Reduce myocardial oxygen demand. Rationale. Beta blockers reduce myocardial oxygen demand by decreasing heart rate and contractility, which is crucial in the acute setting of a myocardial infarction. Question 67. A patient with a history of heart failure presents with jugular venous distension, hepatomegaly, and peripheral edema. What is the most likely cause of these symptoms? A. Left ventricular failure. B. Right ventricular failure. C. Aortic stenosis. D. Pulmonary embolism. Answer B. Right ventricular failure. Rationale. Right ventricular failure leads to systemic congestion, resulting in symptoms such as jugular venous distension, hepatomegaly, and peripheral edema. Question 68. A patient with atrial fibrillation is scheduled for elective cardioversion. What pre-procedure medication is crucial to prevent complications? A. Beta blocker. B. Anticoagulant. C. Diuretic. D. Calcium channel blocker. Answer B. Anticoagulant. Rationale. Anticoagulation is crucial to prevent thromboembolic events during and after cardioversion, as atrial fibrillation increases the risk of clot formation. Question 69. A patient with heart failure is experiencing worsening symptoms despite optimal medical therapy. What is the next most appropriate intervention? A. Increase diuretic dosage. B. Consider a heart transplant. C. Add a calcium channel blocker. D. Reduce physical activity. Answer B. Consider a heart transplant. Rationale. In patients with refractory heart failure, despite optimal medical therapy, a heart transplant may be considered as the next step. Question 70. A patient with a recent diagnosis of deep vein thrombosis, DVT, is prescribed warfarin. What is the target INR range for this patient? A. 1.0 to 2.0. B. 2.0 to 3.0. C. 2.5 to 3.5. D. 3.0 to 4.0. Answer B. 2.0 to 3.0. Rationale. The target INR range for patients on warfarin for DVT is typically 2.0 to 3.0 to prevent thromboembolic events. Question 71. A patient with hypertrophic cardiomyopathy is experiencing syncope and palpitations. What is the most appropriate intervention? A. Administer beta blockers. B. Increase fluid intake. C. Perform a stress test. D. Encourage bed rest. Answer A. Administer beta blockers. Rationale. Beta blockers are used to manage symptoms in hypertrophic cardiomyopathy by reducing heart rate and myocardial contractility, thus preventing syncope and palpitations. Question 72. A patient with acute decompensated heart failure is receiving nitroglycerin IV. What is the primary action of this medication? A. Increase heart rate. B. Reduce preload. C. Increase cardiac output. D. Reduce afterload. Answer B. Reduce preload. Rationale. Nitroglycerin reduces preload by dilating veins, which decreases the workload on the heart in acute decompensated heart failure. Question 73. A patient with a recent myocardial infarction is experiencing recurrent chest pain. What ECG finding would indicate ischemia? A. ST segment elevation. B. ST segment depression. C. Tall, peaked T waves. D. Q waves in leads V1 to V4. Answer B. ST segment depression. Rationale. ST segment depression is indicative of myocardial ischemia, suggesting reduced blood flow to the heart muscle. Question 74. A patient with aortic stenosis presents with chest pain and syncope. What is the most likely underlying mechanism causing these symptoms? A. Increased cardiac output. B. Decreased afterload. C. Reduced coronary perfusion. D. Increased preload. Answer C. Reduced coronary perfusion. Rationale. Aortic stenosis leads to increased resistance to blood flow from the left ventricle, resulting in reduced coronary perfusion and causing chest pain and syncope. Question 75. A patient with a history of deep vein thrombosis, DVT, presents with sudden onset of dyspnea and chest pain. What is the most likely diagnosis? A. Myocardial infarction. B. Pulmonary embolism. C. Pneumonia. D. Acute coronary syndrome. Answer B. Pulmonary embolism. Rationale. Sudden onset of dyspnea and chest pain in a patient with a history of DVT suggests a pulmonary embolism, a common complication of DVT.